let's switch gears for a little bit and talk about something else entirely. Let's talk about vaccines because it's something that's relevant to everyone in one way or another. Whether you are getting vaccinated or you're not, it's a relevant subject. So I wanted to get your thoughts on vaccines and what they represent to all of us.
So yeah, I wanted to talk about the vaccine from the standpoint of the numbers first. The numbers that I really found that were kind of shocking were the fact that African Americans, Latinos, Hispanics, as well as American indigenous populations are upwards of 90% more likely to die from the coronavirus. Um, up to, you know, 2 to 3 times more likely to be hospitalized, and at least 10%, 30%, and even 70% more likely than white Americans to get COVID to begin with. And then when you look at vaccines and vaccine distributions, this kind of this continues to frustrate me because when you look at who's being vaccinated, the numbers for those groups are kind of commensurate with who's actually getting vaccinated. So white Americans are getting vaccinated at a higher rate than all other ethnic groups, as well as yeah. And I was able to look up the numbers for New York, and um, Asian Americans in New York have the highest, at least one dose of vaccine rate, followed by white Americans. Asian Americans are at 46%, white Americans, white New Yorkers at 38%, Latino New Yorkers at 25%, and Black New Yorkers are at 22%.
Mhm.
Um, and so that's one part of the numbers, right? Another, so that's the numbers. The reasons for this is what I wanted to get into with you, because I've thought there's a lot of people who are not really trying to get vaccinated, who are not really interested in the vaccinated, and there's a lot of hysteria around it. Um, and I think that some of it comes from a historical context where you have issues like the Tuskegee experiments, as well as other historical mistreatment of Blacks and ethnic groups in the US when it comes to healthcare, whether it's not women, especially. And then you look at things like um,
Like the
mortality.
mortality rate for
Yeah,
pregnancy. Okay.
exactly. Things of that nature. And so there's a historical distrust that ethnic groups, Black people in particular, have with the healthcare system and apparatus in the US. And then you look at housing infrastructure when it comes to COVID, um, and how for some ethnic groups, we are more likely to be bunched up in apartment buildings and in government sponsored housing, that and you have multiple generations of families living in 1, 2, 3 bedroom apartments versus other ethnic groups who may have a house and may be easier to kind of socially distance from friends and family members.
Yeah, ups and
And
spread.
then
Yeah.
yeah, and then you also have other reasons for these disparities, which are pre-existing risk factors, which include obesity, hypertension, and diabetes, which if an individual has those diseases, are more likely to die from COVID, or more likely to get sick with COVID, or severely ill with COVID. And so there's the numbers behind the vaccine, but then or there's the numbers behind COVID results and lack of vaccines and hysteria, but then there's also the reasons. I also wanted to get some of your take on what you think those reasons might be, as someone who's not necessarily in healthcare.
Uh, it's a complicated issue. I think there's so much current and historical context behind the things that you were talking about in terms of distrust of medicine, in terms of people of color in their communities. There's so many factors at play when it comes to that are not advantageous to people of color getting the vaccine. And that obviously starts with a distrust of medical professionals, the government, and it's almost ingrained in our communities. So it can be difficult to overcome things like that. And then you also have the introduction of things like social media, which plays a huge role. I think that social media gives almost everyone that has access to the internet or a smartphone access to misinformation.
Mm.
And that, coupled with distrust, can it kind of concocts into this uh, potion, I guess you could say, that equals people being opposed to something that could potentially or should potentially help them, if that makes sense.
Yeah, no, that makes a lot of sense. And I've also seen, in it through social media, different posts and people spreading of information, whether it's through social media or even WhatsApp. These WhatsApp chain messages of people saying that the vaccine is bad. All you need is hydrochloroquine. All you need is this, that, and the third. And not to say that there isn't merit to some of what people are saying, or that there isn't reason to be distrustful or to take, information that you get from the government with a grain of salt. Ultimately, it's your job to not just try to prove your biases, but also disprove your biases and try to find the truth ultimately. And also, maybe a reliance on holistic medicine and alternative medicines to either treat yourself from COVID or to just treat yourself in general. But ultimately, you have to weigh out the pros and the cons and the consequences. Unfortunately, for Black people in America, we've seen a disproportionate, and other ethnic groups, a disproportionate amount of death and burden and disease from impact from COVID. I know people who have passed away. I have friends, family members, people in my extended family and community that have passed away, and it frustrates me because if there was a better distribution of information as well as potential remedies to protecting yourself from COVID, I would have loved to have seen them receive that. I don't hear people talk too much about, diet and exercise being a real big factor, and not just diet. And I don't like to say diet, I like to say eating lifestyle, because
Mhm.
that has more of staying power. Diet is very fatty. You get on a diet, you get off a diet, but eating lifestyle seems to me more sustainable. And, just trying to instruct people on how to create a better type of eating lifestyle. Also, sleep becoming a big important factor in disease management. People aren't really getting enough sleep, and as well as vitamin D supplementation. As a remedy, I've discovered that there's a lot of burgeoning research saying that vitamin D supplementation is linked to better COVID-19 outcomes. And even there's some studies from the University of Chicago saying that people who have even higher levels of vitamin D in their blood system are statistically less, very, very statistically less likely to get sick from COVID-19. And as an African American person who has dark skin in the northern hemisphere where you don't get as much sun exposure, your vitamin D levels are going to be lower. And this
Mhm.
vitamin D deficiency is, even though it might not present itself clinically, it leads you to be more susceptible to COVID-19 infections, and as well as to get sick and have more issues. I got COVID last year and I was sick from it. And I would venture to say, because at that point in time, I wasn't supplementing with vitamin D and it was March. And so I didn't get a lot of sun exposure. I could kind of see how I was at risk for even just getting sick and getting the virus. Um, and so I just wish more conversation like this would happen so that people could get a little bit more comfortable. I've received both doses of the COVID vaccine. You said that you got your vaccine shot. What was your experience like with that?
Yeah, I got mine yesterday. It was pretty seamless, pretty easy. I don't have any symptoms. I have a little pain at the injection site, but that's natural because that happens with a lot of different vaccines. I hear people have, maybe some negative symptoms on the second one sometimes, but I mean, I'm not worried about it. For me, it's just the first step to getting back to really getting to live my life again,
Mm.
you know? because as someone that's been pretty cautious about COVID, it's been difficult to be boxed in essentially for a whole year and be restricted on what I can and can't do. And when I do go out, there is kind of a sense of anxiety uh, going out in public and being around large groups of people, even if I am wearing a mask. So it's gonna be good to kind of have that, a little bit of a monkey off my back. But overall, to answer your question, yeah, the experience was positive. I'm looking forward to getting the second dose and approaching the new normal.
Yeah, I mean, and even with getting vaccinated, as well as the side effects of getting vaccinated, um, you know, the chances of someone dying from a vaccine versus the chances of someone dying from COVID, it's like the numbers are way less. And even myself, I've actually experienced some side effects from the vaccine. Chills, shortness of breath, again, pain, not shortness of breath, sorry, chills and fever overnight, as well as, pain at the injection site. But overall, I'm happy because I'm able to, it was like a weight that was lifted off my shoulders once I went through the full regimen. And, I could be a little bit more I felt a little bit more comfortable to travel. I felt a little bit more comfortable to be around, family members, and to even have gatherings of a small sort. And so it just kind of lifted a monkey off my shoulder, and I felt like I was able to get back to some level of normalcy, even though it's not complete. But ultimately, I feel like if we're serious about ending these disparities in COVID, in COVID infections, death, hospitalizations, and just impact, um, we should continue to at least champion vaccines, but and also champion better habits with people just taking care of themselves. Again, obesity, diabetes, hypertension are three of the biggest risk factors for complications of COVID. And those are three things that can be controlled by every individual, for the most part. And so, as long as I feel like if we can be a part of that solution in, kind of pushing that, I hope that we could just continue to spread goodwill and, progress to our brothers and sisters who are, being impacted by this.
Yeah, for sure. I agree with all of those things, and please make sure that I definitely do recommend that if you don't have any prior health issues or allergies to vaccines, to go get vaccinated. But if you are on the fence, I would actually recommend, please do your research, and not Facebook research, not random internet research. Please research accredited sources, listen to the medical professionals, and make your decision from there. Please don't find yourself a victim of misinformation and let that misinformation guide you towards extending your misery from COVID.
Mm. Well said, my brother. Well said.